So let us welcome Dr. Ruth Lanius. Welcome, Ruth.
Thank you, Enrique, and it's an honor to be here. So thank you so much for inviting me. And I'll just give you a brief summary of the training. I think the training is really about thriving in the aftermath of trauma and how we restore that sense of self after trauma. And we will be traveling on a path together where we look at many obstacles that we can encounter in trauma that can make us feel helpless, that can make us feel burnt out. But looking at these problems together and solving them together, I think can make us feel much more competent as therapists and also feel that we have a community of support. And so we'll be talking about how we can deal with intense negative affect, terror, fear, shame, guilt, and anger, and how we can make individuals feel more contained and really come back to the present. And then we will also really talk about the opposite of intense emotions, emotional detachment, feeling emotionally dead, feeling emotionally numb, feeling disconnected from our bodies in the aftermath of trauma, and how we can slowly learn to re-inhabit the body. And this can be very frightening, of course, for traumatized individuals. So really learning a personalized approach with many different treatment modalities that we have available to us, including CBT, EMDR, internal family systems, therapy, ego state work, neurofeedback, sensorimotor works, and others. And then we will focus our attention towards shame. Shame is such a toxic emotion that has such a profound impact on the sense of self. And it prevents us from being able to feel positive emotion such as love, joy and passion. So how can we decrease feelings of shame and bring online feelings of self-compassion, which I think is really at the very core of trauma treatment and often very difficult for us as therapists. And then we'll move on to talk about self-fragmentation, so severely dissociative clients that can also be often very challenging in treatment. And how can we understand their inner world, the different parts of themselves, and how each part of themselves help them to survive? And how can we really provide internal family therapy to help develop compassion and empathy among those parts? And how can we help differentiate dissociation from other psychiatric disorders, for example, psychotic disorders, because voice hearing is equally prominent in dissociation as it is in psychosis. And then finally, we will end the course by talking about how to incorporate neurofeedback into complex trauma treatment. And neurofeedback really is a form of brain training that can help change some of the major brain networks that are affected by trauma. And it shows that the brain is malleable, the brain can change, and it really brings hope online that we all know as therapists we have, and that people can restore their sense of self in the aftermath of trauma through an integrative treatment approach. And so I look forward to working with you in the community over these 5 sessions to really help our clients and to help us as therapists be able to restore the sense of self in the aftermath of trauma.
Thank you, Ruth. And if you work in primary care, if you work in a psychiatric unit, if you are in private practice, join us. Join us. You will benefit from accessing the enormous integration and wealth of information coming from Dr. Lanius' in-depth research. And I guarantee you'll really enjoy the training. Thank you for being with us. Bye-bye.